Our study found that a structured way of regularly reviewing the consultation notes of doctors, nurses, and others who see patients in general practice may help to identify and reduce important differences in the way that clinicians deal with the same patient problems. Our study interviewed 20 clinicians from an out-of-hours general practice service in southwest England to understand the benefits and limitations of a continuous, risk-based consultation peer review system used for the last 10 years to regularly review the consultation notes of doctors, nurses, and other clinicians that see patients. This methodology continuously samples a proportion of all clinicians' consultation records for peer review. The proportion sampled varies between clinicians and is based on their clinical risk status. Risk status is conceptualized as the degree of uncertainty regarding a clinician's standard of practice and informed initially by time working with the organisation and subsequently by ongoing practice. Sample consultation records are randomly selected and screened by members of a trained peer review team with protected time to perform this function. Cases causing concern are escalated for detailed consensus peer review at regular team meetings. Case grading, and where indicated, constructive comments are continuously fed back to clinicians through written electronic feedback to which they're encouraged to respond. Continuous modification of clinicians' risk status on the basis of their practice creates a feedback mechanism to focus the peer review resource where it's most needed. Interviewees indicated the intervention supported clinician learning through improved peer feedback, highlighting learning needs and validating practice. It was compared favourably with existing structures of ensuring clinician competence, supporting standardisation of supervision, clinical governance and learning culture. These benefits were potentially limited by intervention factors such as differential feedback quality between clinicians, the efficiency of methods to identify learning needs, and limitations of assessments based on written clinical notes. Contextual factors such as clinician experience, motivation, and organisational learning culture influence the perception of the intervention as a support or stressor. Overall, we found that continuous, risk-based consultation peer review provides a mechanism to detect and minimise unwarranted variation in clinician practice and a potential methodology to support clinicians in an increasingly multidisciplinary general practice workforce to efficiently and safely practice to their full potential.